Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is emphysema? Emphysema is a chronic, progressive lung disease caused by damage to the alveoli, the tiny air sacs in the lung where the exchange of oxygen and carbon dioxide takes place. /r/n/r/n With emphysema, air becomes trapped, oxygen levels in the blood decrease, hypoxemia, and carbon dioxide levels in the blood increase, hypercapnia. The condition may be complicated by the fact that it often occurs with chronic bronchitis, which causes inflammation and irritation in the airways. /r/n/r/n Emphysema affects roughly 3 million Americans. It is associated with severe disability and decreased life expectancy. Today, chronic obstructive pulmonary disease, COPDwhich emphysema falls under is the third leading cause of death in the United States. /r/n/r/n Emphysema primarily affects the lungs but can also affect other organs and systems, including the heart, muscles, and circulatory system, as the disease progresses. /r/n/r/n Depending on the stage of the disease and other factors, the symptoms of emphysema may include /r/n/r/n Emphysema is also characterized by COPD exacerbations. These are periods when symptoms become worse and require hospitalization. Exacerbations may be precipitated by infections or exposure to air pollution, wood smoke, or even perfume. /r/n/r/n Emphysema can lead to exercise intolerance and muscle atrophy. The combination of decreased physical activity and chronic respiratory stress can promote lean muscle loss, especially in the core muscles, a situation that only increases the severity of respiratory symptoms. /r/n/r/n People with emphysema are also at an increased risk of developing lung cancer. According to research from Northwestern University Feinberg School of Medicine, COPD increases the risk of lung cancer by anywhere from 200% to 500% when compared to smokers without COPD. /r/n/r/n If your COPD symptoms are worsening, speak with your healthcare provider about the possibility of lung cancer. Lung cancer is far more curable when diagnosed in the early stages of the disease. /r/n/r/n Smoking is the most common cause of emphysema, thought to be responsible for 85% to 90% of cases. But there are many other things that can act alone or in conjunction with smoking to cause emphysema. /r/n/r/n While researchers can't be entirely sure why some people get COPD and others don't, several risk factors have been identified, including /r/n/r/n As many as 5% of people with COPD have a genetic disorder known as alpha-1 antitrypsin deficiency. The condition should be suspected when several family members develop emphysema, particularly if none have ever smoked, or diagnosed at a young age, typically considered under age 50. /r/n/r/n The diagnosis of emphysema or another type of COPD is explored through a careful review of one's family and medical history and a physical examination. It is then confirmed by pulmonary function tests, PFTs, which gauge how well you breathe. /r/n/r/n Early diagnosis and proper management and treatment of COPD can offer you a better than average outcome, so it's important to see a provider if you are experiencing any symptoms. /r/n/r/n Various factors may alert a healthcare provider to a potential diagnosis of COPD. These factors include you feeling short of breath at rest or with exercising and/or experiencing a chronic cough with or without phlegm production. /r/n/r/n A history of significant smoking, especially more than 30 to 40 pack years, or a history of significant exposure to various air pollutants or occupational dust are additional factors that may raise suspicion for a diagnosis of COPD. /r/n/r/n Physical exam findings in emphysema will vary depending on the severity of the disease. While one's physical exam is often normal in the early stages of the disease, over time, the following findings may appear: /r/n/r/n pulmonary function tests, specifically a test called spirometry, are needed to confirm the diagnosis of COPD. /r/n/r/n spirometry entails taking a very deep breath in and then breathing out as hard as you can into a tube that is connected to a machine. The machine, called a spirometer, measures the amount and speed of air going in and out of your lungs. /r/n/r/n two key measurements obtained from spirometry are forced vital capacity, FVC, and forced expiratory volume, FEV1. /r/n/r/n traditionally, an FEV1/FVC ratio of less than 70% is used to diagnose COPD. However, some healthcare providers use a different set of criteria, especially for diagnosing young adults or adults who do not smoke. /r/n/r/n at the current time, emphysema remains an irreversible disease. Treatment is aimed at slowing the progression and complications related to the disease. /r/n/r/n treatment involves a combination of approaches, and the course of treatment is largely directed by the disease stage. /r/n/r/n research in lung regeneration therapy is ongoing and may help develop new treatments for COPD in the future. /r/n/r/n quitting smoking is critical for individuals living with this condition and can help to slow the progression of the disease. Speak with your healthcare provider about ways to support your effort. /r/n/r/n engaging in regular physical activity is also important, as it is what will help prevent muscle atrophy and resulting disease progression. But there's no doubt that emphysema itself can make exercise difficult. /r/n/r/n the best exercises for COPD include a combination of endurance, flexibility, and strength training. Your practitioner can help you determine what regimen is best for you. /r/n/r/n there are no drug treatments that have proven successful in slowing the rate of decline of lung function with emphysema. Instead, medications are used to help increase exercise tolerance, reduce COPD exacerbations, and improve overall health status. /r/n/r/n medications used for stable COPD include /r/n/r/n staying up to date with immunizations, especially the flu vaccine and the pneumonia vaccine, helps prevent infections that can worsen your emphysema. /r/n/r/n this can be given continuously, during activity, or for the relief of sudden episodes of shortness of breath. Long-term oxygen therapy of over 15 hours per day is given when a patient has low oxygen saturation levels during advanced, stage 4, COPD. /r/n/r/n there are many benefits of pulmonary rehabilitation, an interdisciplinary program that should last at least 6 weeks. Pulmonary therapy can make a big difference for people living with emphysema by improving exercise tolerance, reducing symptoms, improving FVC and FEV1, and decreasing hospitalizations/lengths of stay. /r/n/r/n lung volume reduction surgery to remove severely damaged tissue may be useful for some people with severe emphysema, especially for those who have disease predominantly involving the upper lobes. Bullectomy may be done in patients who have giant bully. Lung transplant is another consideration. /r/n/r/n emphysema can be a frustrating disease in many ways. Not only do you have to cope with the physical effects of symptoms and treatments, but the impact they can have on your mental wellness and everyday life as well. /r/n/r/n unfortunately, many people with COPD receive inadequate support. If that applies to you, lean on your healthcare team, consider seeing a therapist, and tap into support groups. The American Lung Association is a good place to start. You are not alone. /r/n/r/n COVID does seem to cause emphysema in some people. This may be a result of damage to the blood vessels or damage to the alveoli. /r/n/r/n how long you live after your diagnosis depends on many factors. In general, COPD, which includes emphysema, may decrease the length of your life by more than 14 years. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.